Hello and welcome to the Capitol Report on NTD Television. I'm Steve Lance. Senator Amy Klobuchar is sounding an alert over the possible shortage of election workers. It's less than a month before November's elections, and the senator is saying that states across the country are struggling to recruit enough poll workers. Klobuchar and 15 other Democrats, U.S. senators, sent a letter to the U.S. Election Assistance Commission. In the letter, they say that a lack of poll workers impacted both rural and urban communities during the 2022 primary season. The letter says an increase in threats and harassment against election workers has hampered recruitment. Klobuchar asked the commission to ensure election officials have enough information and resources to address the ongoing shortage of election poll workers. After the 2020 election, many high-profile Republicans have urged voters to get involved in the electoral process. From the DOJ to J6, former President Trump denounces the January 6th committee after it votes unanimously to subpoena him. He then writes a letter to the committee's chairman. Trump asked on Truth Social why the committee waited until it was about to wrap up to try and subpoena him. He says it's, quote, because the committee is a total bust that has only served to further divide our country. Chairman Benny Thompson said the committee recognizes how serious and extraordinary the step to subpoena Trump is and claimed that Trump's testimony would make sure, quote, nothing like January 6th ever happens again. The subpoena is unlikely to succeed since it will likely prompt legal challenges from former President Trump's attorneys. Trump addressed a letter to Thompson in response. His main points were that the committee is ignoring why so many people actually came to the Capitol in the first place, which was a belief the election was a fraud, and also that he called for putting the National Guard in place much sooner, but was rejected. The pandemic isn't officially over yet. That's according to the Biden administration, who is extending the COVID-19 public health emergency declaration for another 90 days. This means measures like high payments to hospitals and expanded Medicaid will continue for the time being. Health Secretary Xavier Becerra announced the extension on Thursday. This is despite President Biden saying in an interview last month that, quote, the pandemic is over. Biden has asked Congress for $22 billion more in funding to prepare for a potential case surge this fall and winter. The Trump administration first declared the emergency in January 2020. It has been extended every 90 days since then. So how long will the Biden administration keep the COVID-19 emergency in place? A slew of recent studies cast doubt over the effectiveness over the COVID-19 vaccines. We sat down with Dr. Robert Malone, physician and biochemist, who is the original inventor of mRNA and DNA vaccines. Dr. Robert Malone, thank you so much for taking some time for us.
Always a pleasure to do anything I can for Epoch Times.
Well, we greatly appreciate that. Doctor, I want to get your thoughts. Florida Surgeon General recently advising against the COVID vaccine for men in certain age groups. Were you surprised by this?
Not at all. The data on, and I commented on this in public, wrote a Substack about it. I actually spoke to Joe for about 45 minutes before I wrote the Substack and did another broadcast interview on the topic a couple of days ago. I think that you have to put his study, the Florida study that you're speaking of, into the context of what we already know about myocarditis in the young male adult. And this is a story that has really a rich literature that goes back to even early in the outbreak when they started deploying this in troops, the mandates for the vaccines. There was a study out from Armed Forces researcher that demonstrated the high incidence of myocarditis in young male recruits or warfighters. So as I said before, the Florida study fits within what's really the preponderance of evidence. And it's just another added document, another added study. It's not really outside of the mainstream at all. What's, of course, bizarre is the gross overreaction of the corporate media because Joe has made a clear and unequivocal statement, but that's his style. and the style of his boss. He's really been empowered by Ron DeSantis. And I could tell you the story of the curtain call on COVID-19, which was the moment in which he made the statement way ahead of the rest of the nation that we shouldn't be using these polynucleotide vaccines on children.
Doctor, if I could ask you, with that in mind, the fact that it does take time for the results to come in, if you will, is there anything that you've been keeping your eye on? I'm sure your fingers are on the pulse of all of the data. Anything that people should be aware of, in your opinion?
We now have had this amazing disclosure by a Pfizer second-tier executive who was confronted in the European Parliament about whether or not they actually ever had any data that the vaccines were going to be effective in preventing spread. And she acknowledged that they didn't. They had no data. And so all of the mandates, lockdowns, and the associated damage was based on, I don't know, a speculation, as Deborah Birx says, hope that the vaccines were going to be effective in stopping spread. And what we've now seen is they don't. The data are now out from all over the world that the vaccines are not, just as I said in the Washington Memorial Steps, they are not preventing people from being infected. They're not preventing replication of the virus. They're not preventing spread. And now it's becoming increasingly clear with Omicron, they aren't protecting against disease or death. And much of the data suggests that the highly inoculated are actually at higher risk for hospitalization and death. So all those stories that we were told, that were mainstreamed in the press, that were, we now have the documentation that the U.S. government was paying people to ridicule those that were raising concerns, paid over $1 billion for actors and musicians and others to influencers to promote vaccination. Yale University did a study of over 4,000 human subjects to refine the messaging on how to get people to take the jab and influence others to take the jab. And all of this was based on hope. That's not a basis for making public health policy, shutting down the country, destroying lives, destroying small businesses, destroying the economy. There has to be some accounting for this.
Dr. Robert Malone, thank you so much.
My pleasure. Thanks for giving me a chance to speak my mind.
Thank you for watching the Capitol Report. If you want to see our full broadcast, check us out at epochtv.com.